The Neuroscience Journal Club is really a unique opportunity for high school students to engage with the world-class research that is happening here at Stanford. And the purpose is to excite young students early in their academic journey to consider a career in the neurosciences, to come together, work with alongside other high school students from other schools, meet other students who are passionate like themselves about science, and just learn.
Hi, my name is Felipe Perez, and I'm a pediatric and adult anesthesiologist at Stanford Anesthesiology Department. I'm also the co-chair of the Anesthesiology Diversity Council, which we call the ADC. Today I'm here representing our leadership team, Dr. Pedro Tanaka, Dr. Rudolph Davis, and Dr. Kelly Foster.
What is the Anesthesiology Diversity Council?
Our Diversity Council was actually started in 2015, and it started off with just one resident, which was me, and two attendings, Dr. Tanaka and Dr. Schaefer.
Stanford has supported me as a trainee in so many ways, really too many to name, but I'll try my best. Stanford has supported me, first of all, in the Department of Anesthesia by providing opportunities to actually engage meaningfully in diversity work. So beyond the GME diversity efforts that have already been in place for a long time, we now have a committee specifically for the anesthesia department where we are able to recruit Black residents, recruit underrepresented minorities into our specialty here at Stanford, and then to work to retain those folks.
Hi, we're sharing some information about the Cardinal Free Clinics. The free clinics have been established since 1990 and have a two-pronged mission of providing free, high-quality transitional medical care for an underserved patient population, as well as educating and empowering a new generation of healthcare leaders to proactively address health disparities and improve access to care in their communities.
The Stanford Medical Scribe Fellowship, also known as COMET, is a one-year post-bac program that was first developed in 2015 by Dr. Stephen Lin. His mission was to create a program that allows aspiring health professionals gain hands-on clinical experience and mentorship while also providing documentation support to Stanford physicians.
Each year, COMET is committed to recruiting an increasingly diverse cohort of program participants. Outreach efforts include connecting with universities' minority student health organizations and tabling at events such as the Stanford Annual SUMA Conference and the Biomedical Research Conference for minority students. Each year, we award a number of partial and full scholarships to URM applicants that fit our definition of a DEI candidate. Funding for the upcoming fellowship year is yet to be finalized. However, we anticipate that any applicant in this category should receive a scholarship if they need it.
Prospective students can find the link to apply on our website for the upcoming fellowship year. The COMET team can be reached at our website or by email to answer any questions and provide further assistance.
Hello, my name is Andrea Jonas, and I'm excited to tell you about the ongoing work of the Stanford Critical Care Diversity Council. Our fellows, faculty, and staff were deeply moved by the protests for social justice over the summer, leading to the development of our Critical Care Diversity Council. Our council includes multidisciplinary representation across all the critical care programs at Stanford, including anesthesia, medicine, pulmonary, and neurocritical care, thereby allowing us to leverage the incredible breadth of voices and experiences at our institution. Our council's efforts have included a focus on diverse recruitment and retention, including instituting a new Diversity Second Look event for incoming critical care fellows, and an internal assessment to hold our division accountable for diverse hiring practices. Our faculty and fellows have pursued leadership roles in diversity initiatives, including involvement in workshop building through the LEAD program. These cumulative efforts have strengthened the bonds of community within our program as we continue to pursue anti-racism work. Thank you.
My name is Wendy Cáceres. I'm an associate program director for the Internal Medicine Residency Program, one of the associate chairs for diversity and inclusion for the Department of Medicine. I would like to share with you all a few of the initiatives we have taken on within the Internal Medicine Residency Program regarding health equity. First of all, we are taking a multi-tiered approach with both the incorporation of these concepts into the curriculum all residents receive, as well as focused programming for those who want to deepen their expertise in health equity, regardless of the field within internal medicine they wish to pursue.
Hi, everyone. I'm very excited to give you a brief overview of our diversity initiative at Stanford. As the title implies, this is a project focusing on imposter syndrome that was started in summer 2019 when we decided to investigate imposter syndrome and the impact of a workshop on imposter syndrome in a radiology department.
Hi, I'm Jonathan Shaw from the Division of Primary Care and Population Health, here to share how we've developed partnerships with safety net clinics in our local community. We believe building bridges between our academic institution and community health centers is key to health equity. In 2018, our division made community engagement a top priority and has since partnered with 3 community health centers that each serve a mission of delivering high quality, culturally competent care. Having faculty embedded in these partner sites promotes diversity, equity, and inclusion, and has had an outsized impact on building community engagement.
The Stanford Presence 5 study aims to advance the art and science of human connection in medicine. Our initial study findings were published in JAMA in January 2020 and included recommendations for how clinicians can foster meaningful connections with patients. Our team includes researchers, clinicians, and staff with diverse expertise in medicine, health services research, implementation science, anthropology, medical education, and communication science. We are partnering closely with clinics that serve predominantly Black patients in Oakland, California, Leeds, Alabama, Memphis, Tennessee, and Rochester, New York, and working with med ed partners at Stanford, University of Pittsburgh Albert Einstein Montefiore, and University of Alabama Birmingham.
My dad died of a heart attack at 39. I was 13 at the time. I am motivated every day by what happened to my father and my family. And this is particularly devastating to immigrant and minority families.
That's why we established the Stanford Center for Asian Health Research and Education. Our mission is to improve the health of Asians everywhere by increasing research, empowering education, and positively impacting Asian clinical care. Since CARE's founding in 2018, We've brought together over 100 Stanford and global faculty conducting research in Asian health,
awarded research grants to outstanding Asian health investigators,
established an executive board of community health and industry leaders,
built partnerships with local and international institutions and governments,
built partnerships with Asian community organizations,
created research training programs for undergraduate and graduate students,
taught Asian health courses throughout Stanford,
filmed a global health documentary with a focus on cultural health practices,
and relaunched the Journal of Asian Health.
We envision a future where every person has access to precise, culturally tailored healthcare that meets their individual needs and ensures equity and excellence for all.
Hello, my name is Angela Jang, and I appreciate this opportunity to present our program, the Stanford Youth Diabetes Coaching Program. First, I want to acknowledge our Stanford Youth Diabetes Coaching Team, Drs. Liana Gefter, Ashini Shrivastava, Nancy Morioka Douglas, and Eunice Rodriguez. Currently, our program is being implemented in San Jose, Columbia, Missouri, and Huntsville, and we've also now expanded to partner with community health workers in rural Washington, as well as with the Central Valley AHEC.
Hi, my name is Audrey Su. I, along with my team from Stanford Medicine's Primary Care and Population Health Division, present our Quality Improvement Project on improving telehealth access in continuous care senior living community. We found language, technological familiarity, and internet connection to be the three largest barriers posed to all residents. To help advance healthcare access and equity, we plan to implement a targeted quality improvement project. This includes providing smart devices and culturally appropriate training to residents, caregivers, and staff around telehealth platforms.
My name is Lydia Tam, and I'm excited to tell you about a course at the medical school, SCORE, Student Community Outreach and Physician Support, reaching vulnerable patients during the COVID-19 pandemic. Students are paired one-on-one with physicians that serve as primary mentors. Through weekly didactic sessions, students learn skills that better equip them for patient outreach. Students then reached out to patients either on the phone or through video to check in on their physical, emotional, and mental well-being. In the past 9 months, over 1,000 wellness check-ins have been made. This initiative has had positive reactions from patients, physicians, and students alike.
Today, I'm excited to tell you about the Palliative Care Health Education, Engagement, and Promotion Team, also called PC-HEAP, working with several community-based organizations, including collaborations with organizations that focus on populations less likely to access palliative care, like Latinas Contra Cancer, SUCUM, New Hope Chinese Care Foundation, and the Chinese American Coalition for Compassionate Care.
The Health Equity Analytics Task Force is focused on analyzing Stanford healthcare patients and communities through an equity and quality lens. Our team is comprised of highly trained clinicians, analysts, and systems experts passionate about improving healthcare disparities to help every individual have the same opportunity to achieve their full health potential. We look at numerous demographic and socioeconomic factors to better understand our patients and to make sure they are receiving the highest quality and access to care, while also identifying opportunities to improve our data quality and reliability. Through our extensive analysis, we can target specific populations and patient cohorts to identify healthcare disparities, improve quality outcomes, and address other political, social, or ethical health issues in our communities. Our goal is to help bring transparency and action to improving health equity, but we all have a role to play in helping our patients and communities achieve their full health potential. Together, we can improve the way we heal humanity through science and compassion, one patient at a time.